Hello, everyone. I'm Mihaela Ionescu, Program Director in ISA, the International Step-by-Step Association. And I've been delighted to accept the invitation to talk about integration in early childhood systems, especially focusing on moving from the why to the how. Just a few words about the organization I'm representing. ISA is a professional association with more than 90 members working in the field of early childhood education and care and development in more than 40 countries, primarily in Europe and Central Asia. We strongly advocate for competent early childhood systems for all children, but especially the most vulnerable one. We really strive to increase the awareness of the importance of early childhood development and equally of a qualified workforce. And as a leading network and the learning community, we strongly promote quality, equitable, and integrated services that work for children, families, and practitioners. I said that I will move from the why to the how. So first, I would just remind ourselves what are the reasons for which we are pleading for integrated services that are working for young children. There is enough evidence showing that children's well-being depend on families' well-being. Therefore, we cannot surpass policies that regard not only children, but families equally. Early years experiences matter tremendously in a person's life. Poverty and exclusion are complex and multifaceted problems. One of the main challenges in combating them is the fragmentation of services, but also that the fragmentation of services does not affect only vulnerable children or families, but all families and all children. Therefore, the complex problems do require joined up approaches. And the 2020 COVID-19 crisis confirmed perhaps even more than there is a high need for integrated early childhood systems that work around and for children and families. Why we need to address integration of services is because we are witnessing a lot of segregation between different sectors on the horizontal, segregation on the vertical, or between different services working with children of different age groups or transitioning from home to services or from one service to another, but also segregation of different levels of governance. If we look at the multi-level layers of early childhood system, starting from the governance at the local to the regional and national level. But this segregation can be seen at both levels, horizontal and vertical. I decided to share with you two complementing contributions to the discussion about moving from the why to the how. And these have been two initiatives where ISA played an important role and still plays that explored more the how than the why. And these are the Intesis and Primokis. Intesis has been a European funded project that really has been innovative in the way of understanding better how integration can work and what we can do to make it happen. While Primokis is a complementing approach that was proposed, let's say, to the field by the Jacobs Foundation, about which we have learned a lot and started implementing it in other countries. I will talk later how these two contributions complement each other. First, I will refer to the Intesis project, which became like a branding of about the journey towards integration. It has been implemented in 4 countries, Belgium, Italy, Portugal, and Slovenia, and we learned that the work continues in those countries. The project itself tried to figure out how we can articulate a framework based on which integration journey could be mapped or could guide any country that would make this effort to forge integration within the systems. And this has been a milestone in the entire work in the project, as we needed to align our thinking based on the learning from lots of experiences happening in other countries, not only in Europe, but across the globe, and learned how they have experienced the work on integration. For that, we have done a literature review, and we have had also a survey learning from the experts at the European level, what is their knowledge about working towards integration. Also, as we have started piloting this approach in 4 countries, we had to learn more about the country contexts, which were quite diverse in terms of early childhood services provision. The framework has guided us, has made us understand what would be the underpinning values and principles that would ground the work in an integrated manner, but also what are the key factors that influence the quality of integration, the intensity of integration, but also the impact. However, even if by identifying the key factors, that would not necessarily be enough if they are not accompanied by those kind of practices that would make a factor influence in a positive way and not hinder the process of integration. The framework has been has stayed, let's say, at the ground of developing the toolkit, how we can make these principles and values happen in practice, or how we can enable those factors to work towards integration. Where do we start? How do we do it? And it has been quite challenging. The pilots themselves have been then evaluated from the very beginning, before we started the intervention, and that at the very end of the piloting period, just to see to what extent we can learn something from the process, having 2 contributions that were quite new, innovative. So we had to learn to what extent they have really contributed to a better cooperation and then coordination to get to the integration among services. And we have also tried to shed the light on what could be the recommendations that can guide future steps in strengthening either the policies that could support integration, but also the how is like how we can strengthen practices that can sustain the coordination across services. I will refer just a little bit on the reference framework, because you could see we've tried to show that a system like the trees are, or every living organism, it's a system where all the pieces are working together, but they need to be grounded in common values, in common principles. And there you can see what have been the principles that we learned that are crucial for promoting the child's healthy rounded development, having the centrality on the child and the family and everything we do across the sectors, have the holistic approach to the child's development, having quality relationships between all those that are working for children and with children, systemic approaches to the work we are doing, diversity and equity so that the most vulnerable are served, learning from the way that we are working, how we can improve through feedback and self-organization, as well as participation has been quite essential in showing that those that are contributed need to be heard. The integration journey started just by looking at all the factors that are crucial in hindering or supporting integration, but also what would be the quality practices that need to be in place. Everything that we've put in the reference framework was then translated in the toolkit. The toolkit itself, it's not only let's say a set of tools that can be used, it also draws the journey through a phased process that brings together different stakeholders from different sectors of thinking together. Why do we need the change in the way that we are working together? What is the rationale for doing it? And this is the why. But also, as soon as we have learned about it and why we would need to do that, we would need to know what do we need to change. So what change is needed? What do we need to do about it? As well as to know how we are going to make that change happen. And then, of course, we will need to assess, did we manage to change something or not? The toolkit for each of the phases proposes different types of tools through which those that are involved in either at the governance management level or either at the frontline work they come together and discuss about it. It's a very dialogic process, but also needs to be very well structured and has to bring all people together and develop a common ground about the why, but also about how. And this is a participatory process that needs to be constantly nurtured, as the coordination implies giving voices to those that are involved in the services, but also have a continuous self-reflective attitude about how we are going to do and how we will know that we have achieved better results by working together. I will just give you some examples of the tools that are in the toolkit. These are for a certain phase of the, at the very beginning, like the rationale, why we need to make the case for integration. And there are several examples of how we can strengthen the understanding about the need for working in an integrated manner, as well as to learn what services are around and how do they count in the ecosystem around the child and the family. Other examples are related to what do we need to change in that case? And that's something that relates to, do we all understand in the same way the child, the family, the professionals, and the services that we provide? Or how can we establish a governance structure for integration? Because we do have all kinds of governance structures, but they are siloed. They are looking in a segregated way at the services belonging to different sectors. These are just some examples that we have tried to articulate, let's say, different pathways that can be chosen depending on the context of each country, even of each city, community, how to go about it. What has happened in the 4 countries? In order to strengthen both the why and the how, policy roundtables have happened with key stakeholders from all sectors and levels of governance. We have brought together professionals that are working in different sectors, so the capacity building, talking about what is our understanding, developing this shared understanding, but also agreeing on pathways of cooperation between services and what would be the purpose for doing that, as well as supporting cross-sectoral communities of practices. These professionals, is not that they would need to meet one time and then never communicate. Coordination is very much based on having this common understanding, common planning, common delivery of services in a coordinated manner. But also the convening and facilitated interinstitutional meetings for strengthening cooperation and for developing local action plans. This has been also essential in creating the infrastructure for integration. I will just refer now a little bit to the evaluation, because it's very important. I presented, how many things we have done in the project, but then we needed to learn, did we manage to achieve something? One of the partners in our consortium developed an index of integration, being specialized more on the evaluation part, and we tried to look and to what extent we could assess that there has been an improvement. And these are the key dimensions that have captured in the evaluation. Well, after 1 year of only 1 year on implementation, I may say the results were quite encouraging, and we could see the green bars that are showing the difference. In some places there was not a substantial change, but in some it has been, and that depended on many other factors. But it has been encouraging to see that by just developing such a framework that focuses our attention on the key elements of integration, as well as having all the activities for a 1 year time to bring people together, discuss about it, agree on ways of doing things together so that we can address critical aspects related to children and families in different communities. It has been quite successful, I may say, as a first step in addressing the problem. I will refer now to the second approach that I was mentioning in the Primo case, and it is complementary, and I wanted to bring it into the discussion because I think it's essential that it promotes a key element in which has been revealed when we did the evaluation and elaborated the policy recommendation. The political support has been essential. The political will, commitment, and support of forging integration in systems. And that's what the PrimoKIS approach does. The target group of this is bringing the administrative and political level of the municipalities, cities, and region in the journey. They need to be from the very beginning and be committed to it. The key factor in this case has been the political will, because it's legitimizing a process. And we did look at both horizontal and vertical networking, so how we can bring together services and how we can make the communicate and coordinate vertically, either across age groups, but also different levels of governance. It's unique to a certain extent, because if the INTERSYS provided a framework, conceptual framework, let's say, that is more programmatic, value-based, the PrimoKIS approach has brought a more of a know-how to sustain this conceptual rationale of integration, and to bring those factors that are ensuring the sustainability of what is created through such an endeavor. And that's the political buy-in. It's a phased process that you need at different times to have not only those that are working in the services, managing services, but those that are making decisions for the services together. And it's the same, a very participatory process as INTERSYS has been. It's a key element. Then there needs to be dialogue, there needs to be discussions in order to bring a shared understanding around why we are doing this and how we should do it. A very important feature of the PrimoKIS was that at different phases in the process, the political representatives, the stakeholders need to be involved. We don't start the process unless they are on board, and we don't move ahead doing, even if we do a situation analysis of how the services stand, on what are the strengths or weaknesses of the system, we do not move towards elaborating any strategy or implementing any strategy unless there is such kind of decision, approval, and endorsement, because anything that would be needed to be changed needs to have either a policy underpinning it, or would need funding to be awarded, or would need to have a lot of monitoring to see if this is really meeting the expectations or not. Well, I would just briefly say that if we look at the PrimoKIS approach, we do learn a lot from the implementation that has happened in Switzerland, Germany, Romania, and currently in Slovenia too, that we need the political will from the very beginning, because it officially legitimizes the process and the commitment. It ensures that an early childhood strategy, it is accepted and is supported. But more than that, that it will ensure that funds will be put for implementation of the strategy, which in the end ensures the sustainability of the entire effort. And how you do that, you involve them from the very beginning in a written form. They need to be part of the working groups or the advisory groups that are that are involved in the process. You need to have this kind of a signature of a politician to work with such an approach. These are a few things that we have learned through the two contributions. They drove our attention in the same direction, but they also showed that we need to have capacity, but we also need to have a lot of political support in making this happen. I will close by sharing with you one of the African proverbs that I think would capture quite well also why we should work together. If we want to go quickly, we should just go alone. But if we want to go far, we need to go together. I invite you to visit our website to learn more about both PrimoKIS and INTERSYS, and I hope that this would have helped you in understanding better and inspire you how to move forward in your own endeavors in the environments where you're working. Thank you very much, and I wish you all to stay healthy, and hope there will be a chance to meet again.